everyone, it's Schematic Med, and today we are going to talk about knee sectional anatomy and MRI insight. Knee is one of the important weight-bearing joint in our body, and that's why it is very common that it can become injured and inflammation can occur. And that's why it is very important to know the knee anatomy. Today I'm going to talk about the knee sectional anatomy in 3 planes: axial, coronal, and sagittal. So let's quickly discuss about these planes and how they cut the body parts. Axial plane is a horizontal plane that will divide the body part into the upper and lower portions. Coronal plane is a vertical plane that will divide a body portion into the anterior and posterior parts. And sagittal plane is again a vertical plane that will divide a body portion into the left and right parts. We're going to talk about each plane separately. Before we start the sectional anatomy, I want to quickly repeat the normal anatomy, and so when we see the sectional image, it will all the structures we will already know. So this is the side view or lateral view and the frontal view. On the side view, we see 3 bones that create a knee joint: the femur, patella, and tibia. Keep in mind that fibula is not part of the knee joint. Here we can see ligaments and tendons. Ligament, let's repeat, is a structure that connects bone to bone. Tendon is a structure that connects muscle to bone. In this picture, we can see a quadriceps muscle, which will go down here. Quadriceps muscle, go down, it will cover the patella, and it will go down and attach to the tibial tuberosity. And this part from the patella to the tibial tuberosity we call patellar ligament. Additionally, we can see a cruciate ligament. We're going to talk about these ligaments very thoroughly in the next slides. But there is only one thing that I want to mention here. We have anterior cruciate ligament and posterior cruciate ligament. When we say anterior or posterior cruciate ligaments, it depends where the ligament is attached to the tibia. So if it is attached to the anterior part of the tibia, it means it is anterior cruciate ligament or ACL. If it is connected to the posterior part of the tibia, we call it posterior cruciate ligament or PCL. Additionally, if we want to connect 2 vertical bones together, we need some structure that will connect them from the side. So we have the lateral collateral ligament and medial collateral ligament. So one thing that I want to mention, and please remember this forever, the fibula is always on the lateral side of the leg. Fibula is always at the lateral side of the leg. So this structure that connects the femur to the fibula is called lateral collateral ligament or fibular collateral ligament, LCL. And the medial part, we have a structure that connects the femur to the tibial medial part, which we'll call medial collateral ligament, MCL, or tibial collateral ligament. The other structures that I want to talk about are bursae. When the body parts and structures are created, we want to protect them. So that's why we have these fluid-filled sacs that we call bursae. So their main role is to decrease the friction. So we have bursae, we call it subcutaneous prepatellar bursae under the skin and in front of the patella. We have suprapatellar, which is above the patella, and below the patella we have infrapatellar bursae, the deep and the superficial one. We have lots of them. I just want to mention this one. So the main point is to understand here it is for protection, to protect the ligaments, to protect the bones from a stress, from the friction stress. So right now let's talk about cruciate ligaments. Cruciate means cross. When we say ACL, I already said it is going to attach to the anterior part of the tibia. When we say it is PCL, it is going to attach to the posterior side of the tibia. So here is a cross, and here is the side view, the 3D view. Of course, this is not my picture, it is from the internet. At the end of this slide, I have a links and references page so that I got all these pictures. Again, these pictures they are not mine, and I just created a schematical structure of it. So this we can see here that these two ligaments, they cross, so that's why they call the cruciate ligaments. Before trying to understand what is written here, I want to explain what you see here. So I did a cut at this level, and we can see the upper surface of the tibia. This part is here, and we can see a femur, the lower part, the lower surface of the femur. So this is the lateral part, and this is the medial part. So now let's try to understand this mnemonic. Lateral ACL. Anterior cruciate ligament comes from the lateral part of the posterior surface of the femur. It goes down, crosses, and it is attaching to the anterior medial surface of the tibia. And the medial PCL, the posterior cruciate ligament, comes from the medial part of the femur, the posterior surface. It crosses and attaches to the posterior part of the tibia, posterior lateral part. Lateral, medial. Here we see the MRI picture. It is the posterior cruciate ligament and anterior cruciate ligament. One more structure, we already talked about this. This is medial part, medial collateral ligament, and lateral part, lateral collateral ligament, which will attach to the fibula. The other important structures that we're going to talk about is the popliteal fossa and the vessels. Popliteal fossa is created by these muscles. The upper part, the medial part, will be the semimembranosus muscle, and the lateral part, upper, will be biceps femoris muscle. The inferior part, the walls, will be gastrocnemius muscle, medial head, and the lateral part will be plantaris muscle and the gastrocnemius lateral head. When we have medial, we have always the lateral. When we have the superior, we always have the inferior. Okay. So the structures we see here will be the same as you will see from the back of the popliteal fossa, and this is your right leg. So we will see the femoral artery, which will become the popliteal artery, and then it will divide to the posterior tibial artery and anterior tibial artery. Then we have the middle, we have the femoral vein, which will become the popliteal vein, and then it will be divided to the other branches. But one thing that I want to mention here at the medial part, remember the fibula is always at the lateral part, so we can say that this is the lateral part. At the medial part, we have a great venous vein that will go all the way down, and it will arise from the femoral artery too. And then we have sciatic nerve. Sciatic nerve will divide very, very important branches that we are going to see. The common fibular nerve at the lateral part, so then the tibial nerve. So why I'm saying this again and again? So when we see the cut of the leg, so there will be no any questions. Is it the medial or the lateral part? We need to see the great saphenous vein. It is at the medial part of the leg. The common fibular nerve, it is the lateral part. So there will be no any questions. Is it the medial part or the lateral part? That's why we're learning this. So we will know which one is which. Additional muscles that I want to say is the popliteal muscle and a Soleus muscle. Soleus muscle means a sandal, but if I tell you that in my language in Armenian we say a fish muscle, I don't know why, but maybe it looks like a fish. This is the tail and this is the head, and yeah, you can remember like that. This is the Soleus muscle. We're going to see this too, and the popliteal muscle he is here too at the back of the leg. So let's move on. We're going to talk about each plane, the axial, coronal, and sagittal separately by itself. So axial plane. Again, axial plane is a horizontal plane that will divide the body part into the upper and lower portions. So I like to depict it like a bread slices. So this is how we're going to slice and see the slices. Again, one more time, the soleus muscle, the gastrocnemius muscles, the medial part and the lateral head, biceps femoris, plantaris muscle, semimembranosus, and here we can see the semitendinosus at the top, and the popliteal muscle, and the popliteal artery, popliteal vein, and the tibial nerve, and the common fibular nerve, and great saphenous vein. And one more muscle that we will see is the Sartorius muscle. And the Sartorius muscle, keep in mind that it runs medially. Let's move on. So this is the MRI picture. This is not mine. The copyright is written here. So I highly recommend you go to this site and you can see the pictures and everything. So it is like you can move on, you scroll, and you can see everything. So I just want to respect the rights, and I'm saying everything at the end of this slide. I'm going to give all the references and links to. This is what the schematically I created. So yeah, and this is the part where the level where the cut is made. So this is the femur, and then we're going to move down. It will be the meniscus and the part where we see the tibia and the fibula together. So here is the red line. So this is the MRI picture. I'm going to talk about these structures counterclockwise. So here at the top we can see this is the anterior part and this is the posterior part. The anterior part we can see the patella, then we can see the infrapatellar fat pad, and in the middle of the picture we can see the femur here too. And femur has the medial femoral condyle cartilage. I don't know, but in my head the cartilages and ligaments, they are blue color, and we can see the medial one and the lateral one. So why it is the medial and lateral one? I already told you that the great saphenous vein, which is the medial part of the body, and the Sartorius muscle, that it is in the medial part of the body too, and the other structures that everything has its own place, all right? So if you know these structures, you can easily say it is medial part or it is lateral part. So these structures that we see here, they will occur on the next slides too. So we have the great saphenous vein one more time, then Sartorius muscle here. And then we have structures like gracilis muscle and tendon, then the semimembranosus muscle, and I like to say them both together, semimembranosus and semitendinosus muscle and tendon. Then we have this gastrocnemius muscle and tendon. We know that we have the medial head, and if we have medial head, it means we have lateral head too. And one more muscle that we already saw and said it is plantaris muscle. The veins and arteries and the nerves that we already discussed, they are the popliteal artery, popliteal vein, and the tibial nerve. If you remember, we said there is one more nerve that we're going to see. It is a common peroneal nerve. Again, plantaris muscle and gastrocnemius lateral head. These are two together. And the biceps femoris muscle and tendon here. We have a collateral ligament. We already talked about that. The tibial collateral ligament and fibular collateral ligament. Fibular or lateral, tibial or medial collateral ligament. And we have here the iliotibial tract. So we're going to see this tract in another picture very clearly. And one more thing that I want to mention here, very, very good depiction here, the cruciate ligaments, the posterior one and the anterior one. There is one structure that I want to mention. It is the femoral sulcus, the front of the femur. So let's move on. So here we see the patellar ligament. We already talked what it is, and we cannot see patella here. This is the fat pad infrapatellar. It is the same, and we can see the medial infrapatellar retinaculum and the lateral one. But this is not infra. This is patellar retinaculum. When we say a retinaculum, it is a band of thickened deep fascia around the tendons that hold them in place. Next, we can see the very, very good depiction of the menisci, the medial one and the lateral one. We can see here that the medial one is a little bigger, and it has C shape. And the lateral one, it is a little round and the smaller one. Again, we can see the structures, the same structures here, the tibial collateral ligament and the fibular one here. Then we can see great saphenous vein, Sartorius muscle, again the articular surfaces, and semimembranosus with semitendinosus muscle together, the Gracilis muscle, and same muscles the gastrocnemius medial head and the lateral head. There's one muscle that you can see here is the Plantaris muscle. Same vessels here, Popliteal Artery and Vein and Tibial Nerve, and the common peroneal nerve. Biceps femoris muscle and tendon is here too, and the, well, already talked, the fibular collateral ligament, and from the medial part it will be the tibial collateral ligament. Then we have the iliotibial tract, and once again these are the menisci that we see. And we can see here the one structure that it is the medial tibial spine. And this is a place of the bone where the anterior cruciate ligament is going to touch. Next cut will be the level where we can see the tibia and fibula. Again, the schematical one and the one that the resource is here. This is the patellar ligament. And we can see here the medial infrapatellar retinaculum here too, the tibia, and the fibula. And this is the articulation that will connect the tibia to fibula. And once again, we can see same structures here. The Coronal vein, the Semimembranosus muscle, the semitendinosus one, the Sartorius muscle, and the Gracilis muscle. Then moving on, it will be the Gastrocnemius medial head and Gastrocnemius the lateral one, lateral head. And then we have Popliteus muscle and tendon, the same vessels that we had, the Popliteal Artery, vein, and we have here the tibial nerve. And common peroneal nerve is here too. There is one muscle that I want to mention, it is the Plantaris muscle. Again, we can see the collateral ligaments, fibular collateral ligament, and the tibial collateral ligament. Again, here we can see the biceps femoris tendon. Here we can see the tendon. One more muscle that is adding up here is the extensor digitorum longus muscle, which will go all the way down to the digits, to the toes of the feet. And again, we can see the iliotibial tract here. So right now, let's move on and discuss the coronal plane. One more time, the coronal plane is a vertical plane that will divide the body part to the anterior and posterior portions. Here you can see the slices of the bread. Again, the picture is the level where the cut is made, the schematical one, and the MRI picture. We can see very clearly the femur and the tibia. And one more thing that we can see, this is the fibula, the head of the fibula. So it means that this is the lateral part and this is the medial part of the leg. Next, we can see at the top of this picture, we can see two big muscles, the vastus medialis and vastus lateralis muscles. And one thing additional we can see here, it is the vastus lateralis tendon. And here we can see the iliotibial tract that I said that we're going to see in another picture. So femur has an intercondylar fossa, and under that we can see the posterior cruciate ligament and anterior cruciate ligament. And again, femur has articular cartilages. Under that, we can see a menisci, the medial meniscus and the lateral meniscus. And the side of these two bones that connect them from the side are the ligaments, the collateral ligaments, the tibial one, and it is not very well depicted here, but the lateral one should be here. A tibia has a intercondylar tubercles, and this is the part, the medial one and the lateral one, this is the parts where the anterior and posterior cruciate ligaments will attach. One more structure that I want to talk about is the pes anserinus. Pes anserinus is a region where a gracilis tendon, semimembranosus tendon, and Sartorius muscle and tendon join together. Additionally, the Popliteus muscle is here, and the Gastrocnemius muscle medial head is here, visible too. At the lateral side of this leg, we can see the posterior tibial muscle, and extensor digitorum longus muscle, and peroneal longus muscle. And one more time, the fibular head, and there is a ligament that connects the fibular head to the tibia. And there should be a lateral collateral ligament here too. And last but not least, the sagittal plane. This plane, it is a vertical plane that will divide the body part into the left and right portions. So we can see the breadth, the slices here are very good depiction here. And one thing that I want to say is sagittal means like an arrow. We all know, I think, the Sagittarius sign and how it is connected to the sagittal plane. It is a plane, like we need to try to imagine that an arrow is piercing a body and passing from front to back. Here is a picture of the MRI and the schematical depiction. I just want to mention that it is schematical picture, so it is not like 100% same as it occurs in the body. And this is the level where the cut is made. We can see here the femur and the tibia and patella, and the patellar cartilage that will join the patella to the femur. Then in front of the femur we have prefemoral fat. And in the top of the patella, we have the suprapatellar fat, and we have here the suprapatellar bursa too. One thing that you can see here, it is the quadriceps tendon here, and we already talked that this is going to cover the patella, go down, and attach to the tibial tubercle, or the tuberosity. And this part will be called the patellar ligament. Under the patella and a little at the back, we can see the infrapatellar fat pad. In this picture, we can see very clear the anterior cruciate ligament and the anterior part of the tibia. It attaches to the anterior part of the tibia, and from the posterior part of the tibia, the posterior cruciate ligament. And very quickly, let's one more time repeat the muscles that we have here. This is at the top of this picture, we can see a semitendinosus muscle with his sister or brother, I don't know, the semimembranosus muscle. And the lower part of this picture, we can see a popliteal muscle, plantaris muscle, gastrocnemius muscle, the lateral head, and the medial head, and the Soleus muscle. One more time, this is a Soleus muscle. This is the gastrocnemius muscle, medial and lateral one, plantaris muscle, a semimembranosus muscle, and the semitendinosus muscle, the popliteal muscle. And one more thing that I want to mention here, it is a popliteal artery or vein that we can see here. So this is the links and references. Thank you very much for your attention. Bye.